so we've got plenty of time for questions, and any kind of feedback would be very well received, because we're still in the middle, as you know, of LSEC, hopefully for longer, but we'll find out soon enough. So I will try and finish before then. So do let me know if I need to stop talking, Hannah, at any point. Okay, so I think most people here hopefully will know what LSEC is. I know it was just alluded to in the talks before. So early language support for every child. It's a Pathfinder opportunity. It's a jointly funded project. It was initiated back in November 23. We were told about it by NHS England and the Department for Education. It was initially offered for 2 years. From a funding perspective, it was 1 million over 2 years. And since that point, we've been really lucky to have various extensions and additional funds. So now we're projected with some agreement financially from all of our partners, who are holding lots of different pots of money, that will be able to go to the end of September 2026, with all of the money that's been provided in total from NHS England and the DFE. And as we all are, we're eagerly awaiting the white paper to understand if this can be a sustainable embedded system offer. And also we've had the approach identified as an LLR, so Leicestershire and Rutland, commissioning priority for speech, language and communication and sustainability across our system. So we've got 2 routes that we're kind of really hoping for, and using as much influence as we can to kind of move forward. And I'm just going to talk today about our approach. We were just asked to come over to explore what we've been doing, where we're at now, some of the outcomes and how it looks. So I hope this meets the expectations of that. So I'll just move to the next slide. So I just thought we'd start off with a bit of population data for Leicester, Leicestershire and Rutland, just to give a bit of an idea about where we are, what we're working in, particularly from a speech and language therapy specialist service perspective, but also at our system level as well. So I've just put some examples here of the data across Leicester, Leicestershire and Rutland. We've got very, very different demographics across those 3 areas, as you can see here. In this case, children in low-income families means families with incomes below 60% of the UK median before housing costs, and where child benefit and at least one other household benefit is received at any point during the year. I just wanted to caveat that, because otherwise there's so much data that could be out there. So we've got a hugely diverse population in the city, with 30% of families who speak a language other than English at home. Across Leicester, Leicestershire and Rutland, we've got 421 primary schools and 900 or over 900 early year settings plus childminders. So we've got huge amounts of people. It's a vast geographical area, huge amounts of children, young people with very, very varying needs. So that's the kind of demographics of where we are. And then Send and Disabilities data is here. So you'll see EHCP trends across all 3 local authorities has gone up, which won't be a surprise to anyone. Again, this is all really familiar and common themes, really. You'll see on the right hand side, the red line across the middle is the average across the country in terms of EHCP application rates per 10,000 children. And you'll see here, actually, we are at an average across Leicestershire and Rutland, slightly lower in Leicestershire and Rutland. And in Leicester, we have got this huge kind of demand for EHCPs and additional support in education settings. Again, we know from my memory, around 30% of those are speech, language and communication needs as a primary need. But that doesn't say that the other 60% don't have speech, language and communication needs as well. That's just that primary need that's listed. So again, it's just wanted to demonstrate, as we all know, but I quite like a bit of an illustrative approach to how the demand that we're all under as a system, particularly around supporting inclusive practice in schools with speech, language, communication needs being a primary area of that. And then to jump into our specialist service information, you'll see here now, we can only get data from 2020, which is really a shame, because again, going back to the comments around data and kind of quality of data, things like that, I'll talk more about that later. As you'll see here, we've actually had really high demand, and we've had over 8,000 children kind of slowly coming down now, with lots and lots of innovation and projects and change in our service. and across the system since 2020. So we saw that huge jump around 2018, 2019 for referrals. And since then, we've just maintained that high level of referral. And we're starting to see now all of that is accumulating into a huge demand and capacity issue. Again, this is known across the country, but it just paints, it kind of plays into the picture of the previous slides as well, to how in high demand our services are from a specialist perspective, but also at a targeted and universal, because we do know that our specialist teaching colleagues in all 3 local authorities, Leicester, Leicestershire and Rutland, they've got very similar trends in their data and referrals as well. And it is nice, it's pleasing to see that coming down, but we are at around 18 to 24 month waits for follow-up intervention. So your first assessment will be within 18 weeks, but that follow-up will be within 18 to 24 months, which I think we can all agree is not the ideal situation and doesn't fit into any of our system-wide thinking around right place, right time, right person. Okay, so for those of you who aren't that familiar with LSEC, I just wanted to run through the objectives from the MOU that we were given right back in November 23. So the first, I've kind of split it into 4 areas. So you've got the early identification intervention for speech, language and communication. I've put needs in there, but actually it's identification or assessment of speech, language and communication, identification of needs to ensure children develop foundational skills. We all know that. Why we're doing that, it's really important. We know that it addresses needs promptly, reduces escalation, improves educational outcomes and supports inclusion. So all of those things were one of the primary areas. Next one was around system workforce skill. So equipping teachers and support staff with practical strategies and confidence to deliver timely intervention at a targeted and universal level, reducing reliance on specialist service, and then creating that inclusive environment again. Our alternative workforce model, so the funding was primarily given for a new workforce model. So that was support worker workforces in speech and language therapy teams to address speech and language therapy vacancies, which were around 30%, by creating a sustainable, resilient layer of support. So support workers, we'll go more into that later, but can deliver delegated interventions, provide continuity for children and families, provide timely access to therapy, and also do lots and lots of engagement and liaison with our partners and development of that system workforce. So works really well. And then the collaboration between health and education. So align priorities, share data, co-design pathways, and basically at the core of it, ensure extra access to speech, language and communication support. That we also find across, because we work across 3 local authorities as one ICB and in one health service. So we were also finding kind of that duplication of lots of different approaches, things like that. So what we've been able to do and what the goals of LSEC were around reducing duplication, creating a unified framework and a vision, and coordinating interventions that meet health and educational needs, working very closely with our SENCOs and head teachers to make sure that that's a priority. So they were our objectives. And so I'll try and explain how we think we're meeting them and how things are going. So I've got here a very kind of, it's a crude picture really of what we're doing, but we were very lucky to have had a previous short-term funded project through NHS England, which we knew locally as the SEND integration projects. That was 21 to 23. So it piloted a universal and targeted training and coaching approach across 19 schools with screening tools, classroom audits, communication champions and universal training offer. So that along the bottom is why that's there, because that has then influenced all of the things that we've been doing as part of LSEC, because a lot of the MOU and outcomes and aims, we'd covered a lot of that. We've developed loads of content. We've been working really closely with our partners through 2 years of that project. So what we were able to do was build on that. So we felt that to address the needs of our LLR population as Pathfinder, again, going back to those first 2 slides of it being huge population, geographical area, hundreds of schools, hundreds and hundreds of early year settings, we thought we'd take our learning from the gaps we identified through our evaluation report, which people are more than welcome to have if you just drop me an email, or Hannah, if you want to let me know if people want the evaluation report from our previous project, to ensure we're directly meeting the objectives in LSEC for our whole population, as opposed to it being another pilot in specific areas. So I'll talk you through each target area in detail on the next slides. But I think just to kind of clarify as well around our approach here. So we took an LSEC clinical pathway, which was around that workforce that we talked about for support workers. We developed a toolkit for at a universal, targeted and specialist level for our partner organisations, so an early years parent toolkit and a primary school toolkit, because this is a 0 to 11 project. We had a system-wide training offer, so across all 3 local authorities, finding gaps in the local authority training offers already, because they've already got brilliant established training through that we've kind of supported in the creation of through their specialist teaching networks. And we also created a small pot for around 20% of the overall budget. We reserve for local bids, so from partner organisations, parent care forums, third party, anywhere. Party, third sector, not third party, it wasn't an insurance claim, but yeah, the third sector. So that was 20% of the budget was reserved for that, which we'll talk more about as well. So that allowed us to start to create a wide system level balance system. And that was the goal. We'd had piloted it, we knew what worked, we'd seen what didn't work, we've seen the pressures in schools, and we completely understand where that is. And we wanted to make sure to address that more directly in what we were going to offer. So I'm going to work through each of these. I think I'll be starting with the, I'll just put a bit more in here for anyone who's interested, maybe when you receive the slides, just as a refresher. But the clinical pathway itself was around an early identification and intervention for speech, language and communication needs, training of a workforce in targeted interventions and developing confidence in that. We then had the toolkit, which was equipping teachers and staff to kind of with very practical strategies, practical assessments, practical screening tools to deliver interventions and identify need really early as soon as they come through into school. And then a training offer alongside that. Okay, and then the additional bits which we'll go through, but it was around aligning our priorities, sharing data, co-designing pathways, making sure that everything is equitable and there's access across all 3 local authorities, again, creating that unified framework. Okay, so I'm going to do a bit more around, yes, I wanted to do a bit more strategic chat before getting into my very operational approach, because I can do that. So I'm just going to try and touch on the kind of inclusive system building blocks. I don't know if people have seen this before. It's around that working model of an inclusive system. So with LSEC, we feel that actually alongside the Send AP change programme, obviously LSEC is a pathfinder of, we're working really effectively across LLR to create this inclusive system in its best form, we feel. So for LSEC, in those 2 outer layers, we've created a unified vision for speech, language and communication and made it everyone's priority. So it's not optional, but it's a core value. We have a steering group that meets once a month that has representation from all of our partners, parent carer forums, our 3 local authorities, health, our ICB, and our Send AP change programme leads. And we come together to discuss challenges to the vision of inclusive systems, to identify solutions and have a shared accountability for improvement and development. We also engage parent care forums more regularly by attending and doing lots of Senko forums as well. We co-chair steering groups alongside our parent carer forum representatives. In local partnership, we're equipping all leaders across education and health with the tools to champion inclusive practice and embed this in their school vision or academy vision. And we're fostering their collaboration with early years providers as well, again, providing platforms on which that can happen. Sorry, that one's just popped up. So that's that. Our partnership is enabling also, which we're really grateful for and have just been so blessed with over the past 2 years, of pooling expertise and reducing that duplication and making everything more equitable, because that was one of our biggest concerns starting this. And in those innermost layers, we're enabling funding mechanisms for projects dedicated to inclusive practice, which we'll go through again more. We're strengthening our data systems and reporting across the system, particularly with speech, language and communication. We're exploring that workforce development and structures and developing those skills for providers to have a shared understanding and consistent practice across LLR around speech, language and communication, and thus the inclusive practice within a school environment or an early years environment. And finally, we're creating strong evidence for the effectiveness of early language support for every child, which enables us to advocate at that local level for systemic funding approaches, so that our inclusion isn't dependent on short-term funding and projects, which, as I've described, has been our experience over the past 5 years. So yeah,
apologies for interrupting. I think there's been some issues with people being kicked out of the group and then having to come back in. So I was one of them, and then somebody else has put in the chat, but there's just somebody been waiting in the lobby, so I don't know whether it's happened a third time. So I'm not sure whether they were admitted, but if people are waiting in the lobby, are we to admit them back in?
I can't see a lobby. I think everyone I don't think there is a lobby. I think hopefully you should just come back in, but I've popped the link in the chat in case it gets booted out again, but I'm not sure why that's
that's fine. Just want to bring it to your attention. Thank you.
Thank you. Right, so I'll just jump forward now to the much more kind of granular detail, I should say. So from the clinical pathway perspective, I just want to talk through the child's journey. So it's an alternative pathway that the children and young people referred into our speech language therapy service will be offered. At the start, there is the referral, so that is then screened by a speech language therapist, and if their needs appear kind of low to moderate, in line with our guidance from our clinical specialists and our team, they are directed through to our LSEC pathway. At which point they are given a local specialist assessment with a speech and language therapist, in which their needs are assessed formally and informally, and they have activities modelled and strategies given to support speech and language, a clear report with all of the findings for schools and settings to understand what their needs currently present as and what they can do next. At that point, next steps are identified and clearly communicated. The options at that point tend to be that their needs need a specialist service and actually are more complex than the referral indicated, so they're transferred to our specialist team, often given a block of intervention first because we're aware of the long ways that I mentioned at the start, or they are pushed forward to our episodes of care, as you'll see on the right hand side here, right at the end. So it's that one, or actually their needs aren't needed and they're a universal need that can be met within their environment. So that's the three options, and at that point we'll direct them and let the families know. If they carry on through the LSEC clinical pathway, they're offered an episode of care. So the episodes of care are prescriptive, very, very clearly written. There's a very strong sense of accountability in the delivery and the quality of them from our team. So they're prescription evidence-based coaching style episodes of care, that I'll go through in a minute because we've got specific ones that I'll talk through, that are offered with a therapy support worker in the most appropriate location for that child or young person. So that could be in home, it could be in their early years setting, or it could be in their primary school, depending. And that is, they are offered with an important adult, and that will be the same key adult or adults, whoever is welcome to come to those sessions, as they're a coaching approach. So it's a coaching style, which I'll talk again a bit more about, in developing the skills and confidence of their key adults in the delivery of targeted intervention across the week. And at that point, when that block of care or episode of care ends, they're given a clear support plan, with lots and lots of guidance, a real refresher on everything we've done, and discharged to the balance system. We also offer a training alongside that, which you'll see at the bottom. So we've got universal and targeted training off of parents and settings that anyone can attend, that sits alongside all of our episodes of care and feeds directly into them around the knowledge and the theory associated with the practical and tangible activities associated with the targeted episode of care. So we chose to take a slightly different approach to the workforce model that was initially suggested through LSEC, again just through our own experience with support worker teams, which we had already established, but also from our experience and learning from our SEND integration project. So we have 2 whole-time equivalent band 7s, one in a clinical team leader role and one in a clinical leadership and data development role. We had then already band 3 therapy support workers in place, and we chose to maintain this role at band 3 instead of the band 4 that was suggested for fidelity and consistency within our team. I'm sure we can all understand why we would do that. We recruited our therapy support workers based on a skills and values-based recruitment as opposed to a clinical skills and knowledge test. And we had already got therapy support worker competency frameworks within our service that assured the quality that we had. We also then implemented Band 6 and Band 5 speech and language therapists, as we're aware of the supervisory requirements of therapy support worker workforces to make sure things are quality and safe. So we made sure that they were in place to provide those assessments to make sure that children were receiving what they needed, but also to provide really high quality supervision and support without having to take that capacity from our core specialist team, who, as you can imagine, don't really have the capacity to give. And we used all of that alongside a really comprehensive continuous professional development plan for all of our new support workers in their first year, a training and shadowing programme, and after a year we felt that they are competent and safe to be delivering independently. Until that point they are really closely supervised with quite significantly reduced capacity. We've had a lot of learning with our therapy support worker workforce, and it will all be in our evaluation report at the end of LSEC. But if anyone in the meantime would like to talk to me about that, then again, please do just get in touch. They're a fabulous resource and very, very impactful. Okay, I'm aware of my time, and I did promise I wouldn't talk over talk, Hannah, so I'm going to just whiz through a few more slides and then I'll come to questions. So we had all of these different episodes of care that we created, and they are targeted episodes of care. So at a targeted level, centered around a coaching model. So for the important person or people around a child to develop their knowledge and skills and support them to develop their language using evidence-based targeted intervention approaches. The coaching model is an I do, we do, you do approach. So the goal here is skilling up that workforce in a practical and accessible way, working alongside a training offer to then embed this into inclusive practice and make it more of a system-wide approach. So we took this approach because we wanted to encourage partnership, shared responsibility, develop skills and reduce the dependency on specialist services to deliver effective and important intervention across the week and every day. And it also allows us to generalise these skills into our school settings so that they can then support a wide variety of children with similarly presenting needs. A lot of these will be really, really impactful for children in that early identification of speech, language and communication needs. We're looking at things like, I don't know if anyone knows about best therapy, talk boost therapy. All of that is incorporating lots of elements into these episodes of care. I'm not going to go through each of the episodes of care here, but they range from our parent-child interaction, so thinking about that simple way in how we connect with our children, so that's parent carers and their children, to communicate and connect during everyday activities and all the strategies associated with that. It goes through all the way through to high level language concepts. So concept cat's a brilliant example. That's come through from the word aware approach and really targets your kind of language concepts. So it goes all the way through from that really early communication style all the way through to high level language interventions, such as language thinking and concept cat, learning words around that one says what it does on the tin. And then we have two speech sound ones are on the bottom here. So where we've got those, again, very mild speech sound difficulties that just need a little bit of a push, someone to show people how to do and how to support them. That is in the minimal pairs and saying longer words. So those two are our speech sound ones, and the other 8 are our language episodes of care. So in terms of the clinical pathway so far, we're really, really happy to say we've had 814 children who have been referred to specialist speech and language therapy services and have gone through on our LSEC pathway, receiving their initial appointment in an average of 3 weeks, and then their follow-up intervention within an average of 3 months, at which point they've then had the appropriate next step. So you'll see 51% of those children were discharged to a safe system following their intervention. 7% were discharged at the initial appointment where we felt actually their needs could be met by their environment. 21% of those children who completed an episode of care were then transferred to our specialist service as they needed further support from us at specialist level, but had plenty to be going on with in the meantime. And 21% were not brought to their initial appointment. And that's what we're working really closely with our data team, our parent care forums, on how we can improve that access to our services and what we can do differently. And that's around, from April 25, around 30 to 35% of all our referrals to our specialist service have been seen through the LSEC pathway, which really is, that's 30 to 35% of all of those referrals having staff around them who are skilled up and knowledgeable and can deliver targeted intervention to support their needs. And we are really, really proud of that. We've maintained the waiting times, as you can see, despite the kind of very, very significant increase in demand over the past 6 months. And also in here, you'll have these case studies and feedback from families as a bit of an example of the work we've been doing with schools and their families. Okay, I'll just jump forward to our toolkit. So I mentioned at the start about our toolkit. We've also created this alongside the other work. So that's an early years toolkit, a school age toolkit, a parent toolkit. They sit on our Health For websites and on the local offers. The toolkit offers different screening tools and approaches to identifying need, navigation of the balance system, understanding different intervention approaches at each level, explanations of how to complete these interventions alongside videos and links, signposting to national and local resource, and specialist referral guidance to improve the quality of referrals we're getting in. And alongside the toolkit, this has been delivered to SENCOs through training. It's not just been sent out there. So we have launch events we've had with our parent care forums and our SENCO forums in attendance. We've had huge collaboration with our parent carers to create this, and they've been really brilliant in supporting our co-delivery of it. And it's been really, really well received. We've got one last launch in the city left, and the counties had theirs and Rutland have had theirs so far. So we're really pleased with how it's going, and we just need now to establish a way to top up that knowledge and keep it relevant and fresh for everyone amidst the huge amounts of reform and change that education are seeing and experiencing at the minute. We've got our training offer that was mentioned as well. So it's allowed us to kind of create recorded training, and there's small chapters that people can access and tap into at various points at that universal level. So speech, language and communication, the basics. We've got communication friendly environments and top tips for talking for parents and carers. We've also got colourful semantics recorded training that will be launching soon. It's been a bit more of a labour of love. And then we do live training, so running a language group, language thinking, wordware, concept cat and outclan, but we're accrediting anyone that joins us on the outclan training that the first year accreditation, which has been really well received. We've had great uptake, as you'll see here. So we've got another 2 terms of training because of our extension on the funding, which is brilliant. So far you'll see we've reached quite a large group of people, but we're looking forward to it being more, and we're seeing bookings coming in left, right and centre, which is brilliant. And we've also we've been approached by academies and did whole academy training where we've managed to reach a much wider group of people, where we've got 20-30 schools within an academy. And we're hoping to expand that offer as well over the next 2 terms, which is wonderful. And then our final kind of section was around additional bids. So our partners submitted bids to enhance their speech, language and communication local offers, really. So we've got Making It Real. Again, I've linked all these in here, which is thinking about the home environment and supporting people at home to develop speech, language, communication and literacy skills. We've also had a speech language assessment training delivered, which is just skilling up and training SENCOs in the delivery of informal speech and language therapy assessment to then support their direction of travel. So do they stay at a universal level, a targeted level, or do they do the referral to us? And we've seen a real improvement in quality of referrals that allow us to really help to identify the needs of a child and put them on the right pathway. We've also done early talk briefs, including all of the resources for those who have engaged in early talk groups. So again, it's just creating, so all of these pieces come together to form that bigger kind of complete puzzle of a balance system for us across LLR that has just been a real gift to be able to find those gaps and fill them really, really effectively with some really strong evidence behind it. So yeah, I think I'll stop talking there because I'm aware that was speedy and a lot of information, and just open the floor to questions. If there aren't any, that's absolutely fine. But yes. Jane.
Hi Gina, sorry, I just wondered if you could just go back to the very kind of second slide for me, because it's, as you say, a lot of information, all really exciting and very comprehensive. But the one where you showed the referral into the specialist assessment and then your episodes of care.
Of course, yes. Let me find that for you. So that's our episodes of care just there.
No, it was like a diagram that showed like different of the 3 boxes from that's it, yeah.
Oh, perfect.
So So the referral comes into the SLT service as it would normally do, not into the project. It's screened by a speech and language therapist, and that screening then determines. Just talk. Could you just talk that slide through in a little bit more detail, because it's just getting my head around that what's in those boxes.
Of course, yeah. So it was felt at the time that to avoid because the team is embedded within our speech and language therapy team. So we were also bound, and this is part of the data quality and the concerns around data generally and how we can do that, is that we couldn't build a whole new unit for referrals and these children and young people to come through to. So we had to put it into our existing process, really, in our existing electronic patient record and monitoring. And so that was one of the kind of reasons we chose to embed it in our general screening. There's also the risk, lowering the risk of us missing quite significant or severe speech and language needs that needs more specialist service input if they came through to the different service. And because we have so many schools and earlier settings across LLR, it just meant that we could keep the process for everyone that they already know was already there, and what we could then do is identify the needs at the point of referral using our referral forms, which is why it was really important for us to strengthen our quality of referral and the skills for the referrers, which is where all of the additional training in the toolkit came in. So they get the referral through in the normal referral system, and what we do then is screen it internally. So triage it, I think probably is a better word. I think we just use a silly word. So we'll triage it to see actually what is this child presenting with, what do their clinical needs look like from a speech and language perspective, and everything that will have already been done because the schools are already implementing, as was mentioned again in the chat in the previous discussions around the universal targeted stuff often is being done already. So what's been done, what's worked and what's not, just to avoid missing things like developmental language disorder, which wouldn't be appropriate to be seen through LSEC because that requires quite significant differential diagnosis and then different approaches for intervention. So they come through that way. So we get the referral through just as all SENCOs and teachers have always done in the same process, at which point we will screen, and if we feel they need to be seen through the LSEC clinical pathway, they'll be transferred through to that team for their assessment, and if they're need to be seen by a specialist service, they get triaged through and sent through to our specialist service pathway at that point. So it's almost like a crossroads, not a crossroads, split road there. At which point they are seen by a speech language therapist still in clinic, because again, the last thing we wanted was to miss any complex language difficulties that might not be identified by our support workers in their interventions. So they're seen just to make sure that, they are at the level that meets the episodes of care, and that the episodes of care that we offer through LSEC can meet their needs, I should say, and just to give them things around modelling strategies. And some of our schools, one of their things that they always want us to do is provide, which is absolutely appropriate and right, provide reports and explanations about what needs does a child present with, in addition to what they can do. So this has just allowed us to create a report for families and for schools or earlier settings, describing the needs of a child or young person, just to make sure that they can get the right support, they can go to the other places that might be able to help them, and we can signpost them to them, but also to really identify with strong clinical confidence that the next steps are appropriate for them in that episode of care, at which point they're transferred to our support worker, who will then deliver that episode of care with the family, the school and the child. Has that helped, Jane?
Yes, that's really helpful, because I think I wasn't clear, that triage bit, as you said. So you're saying you're either in the sort of specialist service pot, or you're in the LSAC pot. And even if you're in the LSAC pot, you still get a full assessment. And as part of that assessment, you're also doing intervention, so modelling straight away, but it's in clinic. And then you're put onto a package as one of your episodes of care offerings that is appropriately identified through that assessment. And that episode of care, those happen presumably in the setting, in the education setting, if the child's in an education setting.
Absolutely, yeah. So they happen in their earlier setting or their education setting, to make sure we're skilling up the people around them to be able to deliver this targeted intervention, because all of these you know, the evidence is strong that they can be delivered by, they don't have to be delivered by speech and language therapists, they can be delivered by practitioners, by teachers, by any support staff around that child with the right knowledge and skills to be able to deliver them. And that's the most, and we also know that they work best if they're done really regularly, you know, 2-3 times a week, not for 3 weeks and then not seen again for 2 years. And we know that confidently. So that was the purpose of making sure it's done.
Do parents attend that session in the education setting? Those episodes of care. So it's the setting and the parent in that session with the therapy support worker.
Absolutely, yeah. And parents are always invited and very strongly encouraged to attend. We can't say we get huge attendance all the time, which is, I think anyone who works with our families who are having to balance lots and lots of things can understand that. But yes, we have got parent attendance, which is fabulous. And often we'll do things like parent-child interaction at home. So where we actually feel that parents need additional skilling up in terms of their approach for communication and interaction, we'll do them at home alongside the parent as well, which works well.
Thank you.
Pleasure. Don't know if anyone else has got any other questions. If not, Hannah, I'm sure we can jump off and have a coffee or something. But yeah, I don't know if anyone has. But if not, it's nice to see you, Gallium. It's very good to see your name.
Hi, thank you very much. I enjoyed the presentation. Thank you for the information. And it's very clear and very organized. Well done. Thank you very much.
Thank you.
I'm from Leicester City Parent Care Forum. So, yeah.
Thank you, everyone. Again, if you need anything, I'll just put my email address in the chat, and I saw some people dropping their emails. So I will send you over the evaluation for our previous project, which was Language and Living, and hopefully when we get our LSEC confirmation about what's happening next, we'll kind of plan the evaluation on that and make sure it's shared widely as well. So yeah, any questions, just get in touch, and thank you very much for your time. Appreciate it. Take care.